Bruyère is a bilingual healthcare organization with 3 geographical sites in Ottawa. But today we'll be talking specifically about Saint Vincent Hospital, which is our biggest site. As an academic organization, we strive for excellence and innovation through teaching, education, and research. Saint Vincent Hospital has 336 patient beds. It offers a specialized program of care aimed to improve and maintain function for patients with complex care with the possibility of returning them to the community. Saint Vincent's Hospital opened in 1932, and in about 15 years ago we underwent major renovations to the hospital, and we use a phenomenal amount of electrical power for anything from lighting, ventilation, heating, all the needs that we need here. The plant is rated for 633 kilowatts, which we believe is perfect for powering Saint Vincent's Hospital and gives us many benefits in return. Our electrical profile indicates that we average just over 600 kilowatts, with our larger loads being in the summer with mechanical cooling is used. We run in parallel with the electrical grid, so in the winter we should be generating 90% or more of our electrical needs and maybe 60% during our summer. It also becomes a secondary form of backup power should we need it in that function. We were awarded a $1 million grant to help with this project. The cogeneration plant was part of a bigger project that included heat recovery of flue gases and any other vents that would otherwise go to the atmosphere to be captured. An application was made with the IESO, Independent Electricity System Operator, and we were awarded the grant. Heat from the engine cooling jacket is used to heat or supplement our 2 hospital heating loops and preheat the domestic hot water. The exhaust goes through a waste heat steam generator, taking some load off the gas-fired boilers. Even to the point of low demand, it is the only source of steam. Since the unit has only been running for about a month, we don't really know how that's going to affect our utility bills. But we do anticipate a drastic reduction in their electrical costs with a slight increase with our natural gas costs. Because the unit is a natural gas-fired engine and we're using the waste heat from it to generate steam, we anticipate that our costs are going to be reduced big time. Bruyère has been pushing energy efficiency in everything we do. For example, we use water-saving fixtures with temperature control and state-of-the-art geothermal well heating and cooling system. Each repair, upgrade, or purchase we make revolves around energy efficiency. The plant improvements at Saint Vincent's Hospital are a testament to this. We didn't just stop at cogeneration, we supported it with other technologies to help the physical plant become way more efficient as well. One of my colleagues compares our plant to the heart of the human body. Without it functioning at its best, something else is going to fail. Those coming through our doors at the most vulnerable time of their lives seeking our help should not have to worry about the infrastructure they're in. We make it our mission to care for the environment as much as we care for our patients.